Good evening. I'm Brett Edwards. They've spent the past 10 months deep in the trenches of pandemia. But tonight, doctors and nurses at Chicago's Mercy Hospital are prepping to possibly lose their jobs after the new year. Mercy in the Bronzeville neighborhood. Doctors and nurses there serve a population that's been especially hit hard by COVID-19. The closest hospital 3 miles away. CBS 2 investigator Megan Hickey joins us live. And Megan, Mercy is known as a safety net hospital.
Right, Brad. Safety net meaning they take care of patients regardless of their ability to pay. Now, despite a vote last week saying Mercy cannot close, staff members tell me that those plans are still in the works. Dr. John Kadecki has been seeing patients at Mercy for nearly 3 decades. And for several months now, he's been fighting to keep Chicago's oldest hospital open.
There's too many people that rely on the hospital. There's a pandemic. It's not a good time to close.
Last week, Kadecki said they saw a glimmer of hope when a state board unanimously rejected the plan to close. But that vote was followed by this email to Mercy staff, saying that despite the decision, they remain committed to their plan to close the doors. Dr. Kadecki told me morale is low.
They're on the front line dealing with patients who have COVID.
Absolutely. The COVID patients just keep pouring in.
Last month, they even lost a veteran nurse to COVID-19.
Her being a nurse was everything. She loved it. She retired. She wanted to volunteer.
Christine Gratzky worked her entire 38-year career at Mercy.
When I say save, y'all say mercy. Save! Mercy! Save! Mercy!
On Monday night, Mercy Hospital supporters braved the cold to show their support.
We have been fighting since August.
It's the activists that are doing that work to keep this hospital open.
State Rep Lamont Robinson has been following this issue closely.
They are under pressure in the midst of this pandemic. They have livelihoods, and we understand that.
And he says he and Governor Pritzker's office are working on a solution. How realistic do you think getting a buyer is? Can you say?
We do have a buyer. We're in conversations with that buyer right now, and we're hopeful that we can get this buyer the support they need to acquire the hospital and continue the health care that we need on the south side of Chicago.
Now, today a Mercy spokesperson told us that while they've heard rumors about a potential buyer, they have had no buyers who have, quote, presented themselves with adequate funding to meet their needs. Now, Mercy originally was slated to close between February and May of 2021.